My name is Dr. Ron Hickenbottom, and I'm the Medical Director for the Broadcast Ministers Alliance Health Awareness Program. Today we have a two-part presentation for you, focusing on women's health, and this is being sponsored by Illinois Department of Public Health. Did you know that breast and cervical cancers are the two most common cancers affecting our women in the U.S.? African American women are disproportionately affected compared with their mortality and morbidity to any other ethnic group. So let's start with some of the key basics about breast cancer. We know that breast cancer is the most common cancer that affects women, second only to skin cancer. Now, while African American women do not have the highest incidence of breast cancer, African American women tend to die at the highest rate compared to any other ethnic group. Now, here are some key basic stats that all of you, I think, need to know. Approximately 183,000 women will be diagnosed with breast cancer this year in 2008. 40,000 of these women will die as a result of their breast cancer. 1 in 8 women will develop breast cancer in their lifetime. 1 in 36 women will die as a result of their breast cancer. Women may develop various types of breast cancer. The most common type is what we call ductal cancer. It arises from the ducts in the breast. This accounts for about 80% of the breast cancer. The second most common type is lobular breast cancer. It accounts for about 10 to 15%. Other types include inflammatory and metastatic breast cancer. Now, we men do get breast cancer. However, women are 100 times more likely to develop breast cancer than men. Let's talk a little bit about some risk factors. Our primary risk factor is age. 77% of the women with breast cancer are 50 years and older. Cancer can and does appear in younger women in their 20s, their 30s, and their 40s. Being a woman itself is a risk factor. Remember, we said that women are 100 times more likely to develop breast cancer. Family history, genetics. If your mother has breast cancer, if your sister has breast cancer, that puts you at a higher risk. Prior history for breast cancer, prior history for other types of cancer such as ovarian and endometrial cancer. Obesity in itself is a risk factor. Increased alcohol consumption, early menses starting before the age of 12, late menopause, starting after age of 55. These are all risk factors for developing breast cancer. So now let's talk about prevention, what you can do. Exercise. Exercise anywhere from 30 to 45 minutes per day, moderate intensity, has shown to help not only reduce the risk of breast cancer, but certain other types of cancer. Our diets. Our diets can play a role in helping us reduce breast cancer.